cases of coronavirus in Victoria. That's 270 new cases since our last update. We conducted 21,995 tests yesterday, which is a very significant effort given the stay-at-home order and so many people that will be, because of those orders, staying at home. I just want to again thank all of those who've come forward to get tested. It's such a powerful contribution to our fight against this virus. Can I also encourage anybody, even with the mildest of symptoms, to come forward, get tested. That gives us the data, the information, the certainty that we need to deliver this strategy to drive down numbers and to get to the other side of this second wave. That means in total we have done 1,170,352 tests since January 1. We have 1,803 active cases. The breakdown on the 270, and Brett can speak to this in more detail, 28 of those are connected to known and contained outbreaks, and 242 of those are under investigation by our dedicated public health team. That's the story of recent days and weeks. Obviously, with such large numbers, it is a real challenge to get to the bottom of exactly where those people have been, who they've spent time with, who are their close contacts, and then to make sure that appropriate public health responses are delivered at that individual and family level right across those suburbs and indeed right across the state. There'll be a Chief Health Officer release later in the day that will go through all the information as much as we can unpack that throughout the course of the day. But I'm sure you would appreciate there is quite a bit of detective work, quite lots of interviews, lots of work that has to go into trying to determine links between different cases, links between different outbreaks. I want to update you though in terms of, as our task grows, so too does our team in a couple of parts. Firstly, as I think there's been some reporting of this overnight, Ambulance Victoria, I'm very grateful to our paramedics for the work they do every hour of every shift, but noting that some in that workforce, for a multitude of reasons, can't be out on the road at the moment, but are still very highly skilled. They have that clinical background, they have that experience with dealing with challenging and complex circumstances. There's a team of about 200 that are being stood up to support the work of our public health team. That number will grow over coming days and weeks, and I'm deeply grateful to Ambulance Victoria for the really coordinated way in which they are joining this fight in a public health sense. Of course, more broadly, the work that they do is critically important, more important than perhaps it's ever been. But where there are off-roster paramedics who have all those skills and bring all those wonderful qualities to their work, but can't be out on the road for various reasons, it makes sense for us to call upon them as our task gets bigger and bigger. I spoke yesterday, I think, or perhaps the day before, about a number of important partnerships with the private sector. I can confirm for you we're quite confident that we'll have a number of staff come across to support all manner of different functions in our public health response, from Medibank, from Telstra, from Qantas and Jetstar. Those discussions continue. So this is about making calls, taking calls, all of that follow-up work. As the task grows, the team needs to grow as well. And preemptively, I think where we'll get to is to train up a whole range of staff from our banks, not to use right now, but in the event for either fatigue management or if the task continues to grow, for them to be potentially deployed in some weeks' time. That's just good forward planning. Now, there'll be a joint statement released by the Prime Minister and I later on today, but if I can just give you a sense of other important developments. I had a good long conversation with the Prime Minister last night. We had communicated over the course of the weekend, and I'm very grateful to him for that standing offer. Whatever we need, we get, and that's a really important thing. The notion that if I need something, I can ask on behalf of all Victorians, and the answer from the Prime Minister will be yes. That's a great comfort and something that makes the task not easy, but just a little bit easier to manage. As you know, there are about 335 ADF personnel that are on the ground now, some of which have been on the ground in really important coordination roles and specialist roles for many weeks now. I can confirm that rather than this being subject to requests and offers and a whole lot of paperwork, we're going to have essentially a standing presence So arrangements just get rolled over, and it's kind of an open-ended thing rather than having to fill out heaps of paperwork every couple of days whenever there's even a minor change to the roles, responsibilities and the numbers of ADF personnel that are going to be here. Those open arrangements, or rolling arrangements if you like, were very much a feature of the ADF's response and their support in our bushfires last summer. So so those 335 will continue to do principally what they have been doing, but there may be some changes depending on circumstances. This obviously is very dynamic, but they'll be staying and they'll be there for the foreseeable future. There will be around 1,000 additional ADF personnel that will join us in the days, weeks, probably over the balance of the next 3 or 4 weeks. It'll take some time to get up to that full contingent. To give you a sense of the tasks that they'll be performing, and again, there will be a statement later today that goes into more detail, but the Emergency Management Commissioner, the Chief Commissioner of Victoria Police, as well as officials in the public health team in my department, have been working very, very hard over these last 2 or 3 days just to work out exactly where we need to surge, where there needs to be additional capacity, and it'll be things along the lines of State Control Centre planning. ADF already in there, but there will need to be more people in there. Logistics and intelligence reporting, public health response, principally focused on data management and analysis, information flow, as well as the allocation of tasks, particularly as it relates to onboarding of new staff. So as the team grows, the proper allocation of tasks and making sure that we're using the best people for the best purposes, making the most of all the skills that we have from that group that I already mentioned, including the private sector, paramedics, the list goes on. There will be direct support from the ADF in relation to our response to outbreaks in public housing towers, so everything from provisioning, getting meals to people, all the other practical things on the ground. That frees up Victoria Police members and allows them to be focused on, if you like, defending that hard border between Metropolitan Melbourne, Mitchell Shire and regional Victoria. Support for testing in metro sites, but also rural and regional sites. That's, again, a function that ADF have already been involved in, and we're very grateful to them down at the showgrounds, for instance. We'll see more and more of that, and some test sites that will be essentially taken over by the Australian Defence Force to do that work. That, again, frees up others to be deployed for other tasks. Assisting relevant agencies with community engagement. So door knocking, being out and about, getting information to people, particularly targeted cohorts. One of the most important, it's a bit novel, but one of the most important agreements that we've struck, the Prime Minister and I, is that Ambulance Victoria paramedic response crews, not all of them, but many of them will be now a shared crew. So one member of Ambulance Victoria, so an AMBO, and a member of ADF, that'll be a general duties ADF person who can support the inevitable number of paramedics who will finish up having to quarantine, having to isolate, having to be furloughed because of exposure or the potential exposure. It's also just a great way to best use the resource that we have, freeing up additional ambulance paramedics. That'll be rolled out quite soon and is separate to AV personnel who've come into our public health response. They're two separate things, but obviously the common denominator is Ambulance Victoria personnel and putting them to the best use possible. Compliance checking, supporting Victoria Police with enforcement of the Chief Health Officer's stay-at-home orders and surge capacity as is required at those vehicle checkpoints right across that ring across regional Victoria and Mitchell Shire. So that is a comprehensive response. It comes from a really strong partnership and it comes from a lot of hard work over the last 3 or 4 days to work out what's needed right now, but to try and be as forward-focused as possible, what's going to be needed in a fortnight, in a month, in 3 months even. This is all about trying to stay a step ahead of the needs. That is incredibly challenging when we see the number of cases presenting each day. But a bigger team, and particularly where you've got great confidence that you're purposing or you're tasking the best skills for the best purpose, that's when you can start to see some really significant improvements.